Hi, my name is Melissa Snyder-Adler and I'm the Chief Medical Review Officer at DriverCheck. Cannabinoids are the part of the cannabis plant that work on our own system in our body, and that system is called the endocannabinoid system. We have receptors all throughout our body. They're called the CB1 and the CB2 receptors, and that's where the cannabinoids take their effect. The most common cannabinoids that most people have heard of are tetrahydrocannabinol, THC, and cannabidiol, CBD. But aside from those, there are well over 100 other cannabinoids. Some of them are psychoactive and will produce a high, and others are not. THC is one of those cannabinoids that produce a euphoria, or what we call a high, and it is considered psychoactive because it impacts the way the brain functions. With THC, we see alterations that occur in perception, mood, consciousness, cognition, and behavior. There are more than 100 different cannabinoids. THC and CBD are only two of the cannabinoids found in the cannabis plant. Those are the ones, though, in products that we purchase, whether it's recreationally or medically, where they will label how much THC is there and how much CBD. THC is that cannabinoid that produces a euphoria or a high, and it is considered psychoactive because of the impact on the brain. Over the years, the percentage of THC has increased significantly. Up until the 80s, the THC that most people were using when they used cannabis was somewhere between 1 and 5%. But now it is common to see THC up to 25% or more. And in fact, with concentrates, THC can be up to 90%. It's a very, very different drug than it used to be when it's that much more potent or that much more psychoactive. The higher the concentration of THC, the more euphoria and that larger the high. Now, CBD is the other cannabinoid that we often talk about, but it does not produce a high. CBD on its own can still have some side effects that may be impairing, things like somnolence or sedation, feeling tired. And just like any other medication, for example, Benadryl, even though Benadryl is not what I would call psychoactive, if you take it, it may make you feel tired, and that can be impairing. So although CBD is not psychoactive, that does not mean that is not impairing. CBD is commonly found in oil form, and when people think about CBD, they often think about CBD oil. CBD oil, though, does have some THC in it, and that amount varies from product to product. Even the products that are labeled THC-free or no THC generally have some THC. And that THC may be 1%, maybe a little bit less, a little bit more, and that part of it can also add to the impairing effects. Any CBD oil may also have other cannabinoids in it, and those cannabinoids may be psychoactive as well. Now, CBD may block or lower the negative impact of THC on the brain when it's taken in higher doses than THC. When we look at products, they often have varying amounts of THC and CBD and can give different effects because of it. And even though those are the only two cannabinoids that are labeled in most products, there are other cannabinoids in there, and we are starting to learn more about this through research.